protected in 5 days. And so, you know, I mean, you still got that window, but, and for sure giving them the local immunity by giving them the intranasal, I mean, that's really helped a lot. So the big thing is the kennel cough, and then getting them out of the shelter. The parvovirus, I mean, that's the big killer. I mean, that can shut a shelter down. Like I said, because of our movement, and we don't handle dogs a whole lot. That's the other thing we don't do. I mean, only certain people handle. So we try to keep that limited. That's the parvovirus. And then the Giardia is the other big guy that we worry about. So those are the big things. Most shelter, it's the kennel cough. And then, well, parvo is what will close you down. Yes?
Have you ever had any cases of lepto in the shelter?
Not that I know of. And really haven't had any diagnosed either. I mean, we always keep an eye out for it. Part of the way I convinced our kennel attendants to wear their gear was to scare them about brucellosis and leptospirosis and all, you know, because in fact, when you protect the dogs and they protect, I mean, if they protect themselves, they protect the dogs, you know, wearing their gear, I mean, and, you know, of course, once again, I mean, we have these super nice DuPont one-use covers, and then we have all the gloves we want, you know what I mean? We have the ability to have all that stuff. When I saw them working with the Ebola and they had duct tape taped around their gloves, I mean, that's what they do for humans. Freaking splash guard, tops like we had, gloves, and they had duct tape. That's how they treat Ebola people, if you pay attention. So we're almost doing more than they are, which is kind of crazy. So, anything else? Yes?
What's the like average, like a dog comes in and gets county adoption form, what's their average stay there?
8 to 9 days.
So if they don't get adopted in that 8 to 9 days, are they?
They stay, once they are picked for adoption, that's why the medical is so important. They are in for life. So that's what.
Theoretically, they could be there for like years.
Yes, but they'll go crazy before then. So, I mean, and you know, we have foster programs and we have the rescues. You know, when people complain, we say, fine, you know, you want to rescue dogs, you take the ones we have on the floor. You know what I mean? So and those, you know, we're finally getting, you know, the whole technology thing going, you know what I mean? And people, they want us to do more adoptions, they want us to kill less, yada, 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 but then dogs got to get adopted. A lot of people can't understand why we don't have on a guillotine 2 dogs on each side, you know, everything bad that causes disasters. And basically, when we hit times with rescues where they can't take it because they're full up, we're not going to make the same stupid decisions they did. We're not going to do that. We have not had to kill, well, my director was asking me why last week the euthanasia rate was up. Well, when the 47 pit bulls broke with Giardia and we didn't have 2 wards to receive into, we have to be able to take in dogs. We've never had to euthanize for space, but if that's what happens, that's what happens. And that's why everything has to roll along. We haven't had to do it yet, but if it came to it, that's the way things are. I mean, we can't just have the wardens driving around with dogs. And I mean, these guys come in 3 shifts. I mean, that's what we deal with. Anything else? That's why last Sunday I was clinicking dogs and putting them to the adoption ward that was closed, that hadn't had surgery yet, so that we could make room for dogs coming in, so that on Monday they could have surgery and then go back. So that's how I spend my Sundays, is just making room. So that's what we do. So last week, when we didn't have room, then dogs waiting for rescue, you know, they just can't wait as long. Anything else? All right. There's our mission statement, whatever that's about. No, it's all good. And I think the other big thing about us is that, you know, we're not the Humane Society. We are mandated by laws to what we do. And so when people are like, you know, don't euthanize, I mean, if that's a vicious dog, I mean, that's just the way things are. So we are strictly under Ohio Revised Code Section 955. So capillarity isn't, but capillarity also can say they won't take an animal. We don't have that luxury. We also do provide euthanasia. I mean, that's a big part of our biz, unfortunately. I mean, within the shelter and also if people bring their dogs in. And then just to kind of show you, where we're at, our adoptions have been going up, rescues have been going up, return to owners have been going up. So we've been doing a pretty good job. I keep trying to tell everyone that it really, if we get 100 dogs that are adoptable, fine. If we get 100 that aren't, that's just the way things are. I'm not really that crazy about numbers. We will go to any length to put a deserving dog up, but we are not going to put up a dog that's going to be dangerous. The big other thing that happened on 2012 is when pits weren't, every pit was euthanized up to 2012 that came into that shelter. When I was at the old shelter, as a veterinarian, I didn't have to do it, but the techs, litters of pit bull puppies, cutest little things you ever saw. That was very, very difficult. Now that we don't have to do that, right now we have 6 pit bulls on our adoption floor. We're allowed to have 10. They're getting adopted, so we can keep them rolling through as quick as they come in. So that's really, really nice. And we don't really do a whole lot of puppies anymore of any type. All puppies get to go to the floor if they're under 6 months and they're medically sound. We don't worry about behavior. So for everything we do, it costs $123 to get a dog adopted. That's neutered, microchip. If that dog had a $5,000 procedure, it's $123. So, like I said, it's kind of a crazy place. All right. Anybody else have any questions there? Yes. Of course, we do. Those people are scrutinized quite a bit more. There is no law. Like Reynoldsburg, you are not allowed to have them. I don't know if you guys are that familiar with this area, but in Reynoldsburg, you're not allowed to have pit bulls. You're not allowed to have them in Bexley. So, that's just the way it is. There are still laws that say you can't have them. We do scrutinize people that are taking pit bulls much more than we do other dogs. But everybody, we try to do our best. We're pretty good about not having many adoptions come back. But we try to not make it too tough, but yet we don't want them going to a bad situation either. So we've been pretty fortunate with that. Yes.
How can we get involved with the volunteer program that your shelter runs?
Call the shelter and talk to the volunteer.
Give us one number.
Yeah, 525-5400. Yeah, you guys, you should, if you, just from an interest standpoint, it is something to see. It is probably one of the nicest ones you'll ever see. Anything else about veterinary medicine in general? I know a little bit about everything. All right. Yeah, go ahead.
What's your behavior team like? What's the staff like? I haven't heard of it before.
Now, what's up?
What's your behavior team staff like? Are they doctors?
No. There is no, the big thing is, I don't know if, once again, I know quite a bit about this. There has been no, there is no behavior test that will predict how a dog will do outside the shelter. Which I know there is a behavior program at OSU, and you'd think they'd be working on it, but I haven't heard anything about it. But that's the bottom line. Any place you look, we do the best we can. When I was in private practice, behavior was the biggest thing we did. We never had somebody give up on a puppy because of behavior. Even if it meant we did it ourselves. Housebreaking behavior. So there's a lot of us who know a lot about dogs, and we're pretty good at predicting how it's going to turn out. We don't have dogs come back for biting people. Of course, things like separation anxiety, you're not going to find out until they leave. That's probably one of the bigger things. And like I said, you get dogs that have never had any kind, and probably the worst ones are ones that have been owned, that the people didn't do anything other than spoil. Those guys are very hard to try to get them turned around. Sometimes it's better if somebody did nothing with them, and you can kind of start with a blank slate. Anything else, guys? Well, wish y'all luck.